Thank you, Bruce. Merci, Bruce. Bon après-midi, tout le monde. Good afternoon, everyone. Pendant plusieurs mois, vous m'avez entendu dire que nous sommes tous dans le même bateau. Je parlais des Néo-Brunswickois et les Néo-Brunswickoises aux quatre coins de la province. Nous avons tous collaboré pour assurer notre protection en limitant la propagation du virus responsable pour la COVID-19. Et nous devons continuer de faire parce que bientôt, nous aurons de la compagnie dans notre bulle au cours de la COVID-19. Au cours des prochains jours, les provinces de l'Atlantique vont assouplir les restrictions de voyage à travers leurs frontières pour permettre aux résidents de se déplacer plus librement à l'intérieur de la région. Le Premier ministre parlera en détail de ce plan dans quelques minutes. Cependant, je vais vous expliquer pourquoi je suis à l'aise avec cette décision et pourquoi vous devriez l'être aussi. For several months, you have heard me say we are all in this together, and I have been speaking about all New Brunswickers in every corner of our province. We've been working together to keep one another safe by limiting the spread of COVID-19. And we have to keep doing this because we will soon have company in our COVID-19 bubble. In the coming days, the Atlantic provinces will relax some of the restrictions on travel across their borders to enable residents to move freely within the region. The Premier will speak to the details of this plan in a few minutes. But I want to explain to you why I'm comfortable with this decision and why you should be too. After months of isolation, the prospect of opening our borders to some people may be scary. It is interesting to see people's reactions around different lifting of restrictions. Some people find it very anxiety-provoking, and some people find it very encouraging, and that's okay. Limiting the movement of people has limited the movement of the virus to this point, and that has kept our case numbers relatively low. I'm convinced we can reconnect with others safely and still stay safe if we remain committed to protecting ourselves and our loved ones. And the discussions that we've had across the country with other chief medical officers of health, as well as the chief medical officers of health from the Atlantic provinces, have been very much focused on our epidemiology and our numbers currently and how we see things moving forward. So we've had great collaboration in that regard. So we do have to continually adjust our thinking and our behavior to the reality of this pandemic. And again, that's what we do on an ongoing basis. Every week we have many meetings to discuss all of this information and readapt our approach and learn from all the new information that we get. So right now we have, 750,000 people in New Brunswick, and I'm sure that with 2.3 million Atlantic Canadians that we can still move ahead together with this approach. So while there are no new cases to report today, please remember that COVID-19 is still with us, and we continue to expect, as we expect in other provinces as well, again, as I've spoken with the other chief medical officers of health across the country, are travel-related cases. So we'll continue to be expecting those types of cases, but if the people who are coming from areas where there are active outbreaks, we are very concerned about continuing to self-isolate for 14 days from those areas. But certainly within the Atlantic provinces, because our numbers are all quite low and we feel very confident that we can move freely without that 14-day self-isolation right now. So that's a good thing. Yesterday, an individual between 50 and 59 tested positive for COVID-19 in Zone 1, which is the Moncton region, and that is a travel-related case where they traveled from outside the province. They were self-isolating at the time, and there aren't actually any close contacts with that individual. So that's a good news story in the sense that the self-isolation piece is working in that situation. So, So the ongoing presence of the disease can't really prevent us from moving forward. Again, some people causes a lot of anxiety for, and some people are encouraged by moving forward. And again, I think both of those feelings are quite valid. Until a vaccine or other reliable treatment is established, we will continue to see new cases in New Brunswick. And based on how we've managed the outbreaks so far that we've seen, I am confident with the approach that we've used that we can continue to manage these outbreaks as they emerge. This will also happen in Nova Scotia, Prince Edward Island, and Newfoundland and Labrador. And again, their approaches to their outbreaks have been have had very successful outcomes at this point in terms of keeping the numbers low right now and in terms of active cases. So we, as a collective group of Chief Medical Officers of Health, have agreed that that is what we're comfortable with moving forward. And I've discussed this with my Atlantic colleagues. We agreed that increased movement within the region is an acceptable risk at this time. And certainly over the course of the last few months where people haven't been able to move around very much, that allowing that movement to happen now is a good thing. On many levels. So if you look at the social determinants of health, socioeconomic issues around what has happened with COVID-19, again, these are positive steps forward. Overall, Atlantic Canada's case numbers have been declining steadily, and many areas within the region have been COVID-free for some time. When people move, however, the virus can move around as well, and so that's why we do still have to remain vigilant. There is an outbreak actually outside of Houlton, Maine, or in Houlton, Maine rather, which is just across the border from Woodstock. So we know that we have to continue to be vigilant no matter where or when we are in the progress of the pandemic. So I would ask everybody to continue to symptom watch. We have a very short list of criteria to get tested at this point in time, which only includes one symptom from the list on our website. So continue to symptom watch, and if you have any concerns, call Telecare 811 and you'll get some directions there. So please remember to keep 2 meters of physical distance between yourselves and others whenever you can. And this is particularly important at larger gatherings, such as weddings and funerals, etc. So, you know, when we look at the risks that we are dealing with right now, those larger gatherings do pose more risk. And so we do need to be way more cautious around those types of events. And I do know that people are working very hard to make them as safe as possible and make sure that people are following public health guidelines and direction. But sometimes we don't keep our guard up when we should, and again, these are things that we have to remind each other of. Lorsqu'il est impossible de respecter les consignes de la distanciation physique, portez un masque en tissu qui vous couvre le nez et la bouche en public. Une bonne hygiène limitera aussi la propagation de la COVID-19. N'oubliez pas de laver vos mains régulièrement et à fond plusieurs fois par jour. Évitez de toucher le visage. Nettoyez les surfaces touchées régulièrement comme les poignées de porte et les comptoirs. Ces actions sont votre meilleure défense contre la COVID-19 à l'intérieur et à l'extérieur de chez vous. Et comme je vous avais dit tout à l'heure, c'est les groupes de rassemblements qui sont plus larges, qui posent un gros risque. Alors, c'est dans ces situations comme ça qu'on veut que vous soyez plus vigilantes. Et aussi, proche des territoires où il y a des éclosions, comme Houlton, Maine, on veut que si vous soyez proche d'une éclosion, de suivre les directions de santé publique, gardez pour les symptômes. Si vous en avez, téléphonez au 811 pour vous faire tester. Et sans oublier de vous protéger et protéger les autres, vous pouvez quand même profiter de tout ce que l'été a à offrir au Canada atlantique. Et je vous encourage tous à profiter de cette possibilité. Tout comme notre santé physique, nous devons maintenir notre santé mentale. C'est très, très, très important. Nous avons tous besoin d'un changement de décor, de la possibilité d'explorer et de voir le monde autour de nous. Notre bulle au cours de la COVID est sur le point de grossir. Nous sommes toujours encore dans le même bateau, mais bientôt nous serons plus nombreux à partager une telle expérience. Ouvrons les bras à nos voisins et nos amis du Canada atlantique. Et comme je vous avais dit tout à l'heure, c'est des discussions qu'on a eues entre les médecins hygiénistes en chef des 4 provinces atlantiques et aussi les premiers ministres. Alors, les discussions sont très positives au niveau de voir que les cas dans les 4 provinces sont vraiment bas à ce moment-ci. Et c'est pour ça qu'on est très confortable à avoir un échangement de déplacement entre les régions atlantiques à ce moment-ci, parce qu'on croit que c'est sécuritaire, c'est bon pour la santé mentale, c'est bon pour l'économie, et ce sont des déterminants sociaux de la santé. Alors, c'est vraiment important d'adresser toutes les parties de notre santé, pas juste l'effet du COVID-19. Explorons notre province et cette région du pays. Profitons tout de cette possibilité avec une distance physique appropriée, bien entendu. C'est l'appel de l'été pour chacun d'entre nous et je ne pense pas penser à meilleur endroit où le passer. Merci beaucoup.
Good afternoon. Bonjour. Today, I'm pleased to announce that at the end of the next week, New Brunswickers will be able to travel freely within the 4 Atlantic provinces. I want to thank Premiers McNeil, King, and Ball during recent weeks for their insight and cooperation in forming the Atlantic Bubble. Beginning next Friday, July 3rd, residents of New Brunswick, Nova Scotia, Prince Edward Island, and Newfoundland and Labrador will be able to travel within the 4 Atlantic provinces. Il ne sera pas nécessaire de vous auto-isoler quand vous irez dans les autres provinces. Et il ne sera pas non plus nécessaire de le faire à votre retour au Nouveau-Brunswick. There are still rules we will all need to follow. You cannot leave your province of residence if you have been outside of the Atlantic region for any reason in the past 14 days, even if you were traveling for work. New Brunswickers who have to travel outside of the region for work can still return to the province of New Brunswick without having to self-isolate. You will not be able to visit the other provinces if you have been advised to self-isolate or if you are awaiting the results of COVID-19 test. You will need to self-monitor for symptoms, and you are not permitted to travel if you are experiencing symptoms of the virus. Peace officers will still be monitoring New Brunswick borders, and travelers will need to provide proof of their province of residence. We will be collecting travelers' information so we can conduct contact tracing in the event of an outbreak. Each province will have their own process in place to track and monitor travelers for public health purposes, and New Brunswickers will be subject to those rules when visiting other provinces. Nous anticipons une plus grande circulation à nos frontières dans les prochaines semaines, et nous allons prendre des mesures pour minimiser les répercussions. Last Friday, we announced that Canadian residents are permitted to enter the province to visit family members or to stay at properties they own, as long as they self-isolate for 14 days. That policy will remain in place for Canadians from outside the Atlantic provinces. Since we made the announcement, traffic flow has increased, and as a result, we have increased staffing at our borders. Personal vehicle traffic on Monday was up 52% compared to the average count since March 25th. A total of 3,441 personal vehicles and 3,794 commercial vehicles approached the border on Monday alone. We have the staff we need to address this increased volume. We will continue to ensure officers are in place to conduct screening, while also taking steps to improve traffic flow and move transport trucks through the screening process faster than personal vehicles. Our mandatory order will also be extended for 2 more weeks on June 25th, with 1 revision. As planned, Zone 5, the Campbellton region, will be moving back to the yellow level of recovery this Friday, June 26th. L'inclusion dans la Zone 5 a été une source de préoccupation importante depuis plusieurs semaines, mais les données récentes montrent que nous faisons des bons progrès pour gérer la propagation du virus. Un plus grand nombre de personnes sont rétablies et il n'y a pas de nouveaux cas confirmés dans cette région depuis la semaine dernière. Starting on Friday, residents of Zone 5 can join the rest of the province in extending their 2-household bubble to include close family and friends. Les fournisseurs et entreprises de services de santé non réglementés, comme les acupuncteurs et les naturopathes, pourront reprendre leur activité. Les entreprises de services personnels, comme les barbières, les coiffeurs, les spas de manucure et de pédicure et les tabouilleurs pourront aussi ouvrir leurs portes. All remaining New Brunswick businesses will also be allowed to open this Friday, June 26th, including Zone 5, as long as they are able to ensure proper sanitizing and physical distancing measures are in place and they are following WorkSafe NB and public health guidelines. According to the latest survey numbers released this week from Canadian Federation of Independent Business, New Brunswick is leading the way when it comes to reopening our economy. The survey shows that 70% of New Brunswick businesses are now open, significantly more than any other province. 29% of New Brunswick businesses are reporting they are at or above their normal revenues right now, which is also higher than any other province. Our economy is already making great progress toward reopening. And with all New Brunswick businesses permitted to open, with safety measures in place, beginning on Friday, we will continue to take steps in the right direction. Right now, however, I would like to share a good news story. Many family members throughout the province have experienced a loved one who had gone through COVID, the virus, and been sick or ill. Unfortunately, we've had 2 deaths in our province, and my heart goes out to those family members that had experienced that within their midst. I do, however, want to recognize a couple. I received a letter yesterday from Tom Higgs, who lives in the Campbellton region. Firstly, I was surprised that I'd received a letter from another Higgs in the province that I had no idea that existed. So after, and I've spoken to Tom, and I also spoke to his father, Gifford and Lorraine Higgs. Gifford and Lorraine both came down with the disease. And they have been married for 71 years. And they spent time in the Campbellton Hospital. I want to recount what their son, Tom, sent to me. So we had both Tom's parents and his wife, Lorraine, that all came down with the virus. Tom and his wife experienced a return to health at home. They were isolating at home. But his father and his mother were in the Campbellton Hospital. And he recounts the great care that he got by the healthcare workers in that facility. He recounts how they put themselves at risk to look after his parents. And he recounts how they made it even more special when they made arrangements to have both him and his mother in the same room. And even though his mother experienced additional complications during their time in the hospital, the 2 of them together willed their health return, and together they fought the disease, and together they returned home. And today, they're home enjoying their life back in their independent living in their own home with their son and their daughter-in-law. So even though, points that we've gone through, the stresses we go through as family, Tom comments that now he has a whole new appreciation of how important life is. So while this is an extremely good story, and obviously I'm pleased to share it, and I spoke to both his father and Tom this morning, had a wonderful discussion with both of them, particularly his father. We were on the line longer and talked about reminiscing about actually where we were from and how the roots of our surnames and where they originated. So we've got more of a family tree to chase now to see how we may be connected. So that was even more special. But I think the point of all of this is there are good news stories coming out of this COVID pandemic. And they're a challenge we're all facing. But we will come out of them with a stronger and a greater appreciation, not only for our health, but for the province we live in and our ability to deal with adversity and move beyond it, and move beyond it in a very significant way. So I thank Tom so much for the letter. I know there's others that have recovered. I know that there are good news stories around the province as we start to move into life as normal with COVID, but there's hope. There's always hope for us to do better, to move beyond, and to, at the end of the day, have a vaccine that this will no longer be a threat. But for now, we live with it, we learn to cope with it, and we do it in a very strong way that we're looking out for each other, just as this family looked out for each other through their time with this disease. Thank you. Bonjour.
Merci, Monsieur le Premier ministre et Dr. Russell. Thank you, Premier Higgs and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We'll now proceed with questions from the media. You have the right to pose your question in the language of your choice. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour probablement Dr. Russell. Quand il s'agit de respecter, parce que dans le communiqué, on dit qu'il faut respecter les exigences de chaque province. J'aimerais savoir, est-ce que les règles sont uniformes ou pas dans les 4 provinces de l'Atlantique?
Je peux juste vous dire au niveau de santé publique, ça veut dire que la nécessité de isolé pour 14 jours n'existe pas dans les 4 provinces si vous voyagez entre les 4 provinces.
Monsieur Corriveau, as-tu un suivi cet après-midi?
Oui, celle-là, c'est peut-être plus pour le premier ministre à ce moment-ci. J'aimerais savoir, là, pour ce qui est de l'ouverture aux autres provinces canadiennes, est-ce que vous en avez discuté avec les autres premiers ministres, M. Higgs, et est-ce que c'est toujours prévu pour la mi-juillet?
So yes, we have discussed it in the timing of when we would open up with the Atlantic bubble. And so we'll gauge the success of this, and yes, looking further into mid to late July as an opportunity to move further through the rest of Canada is certainly a discussion point and certainly in the realm of possibility.
Merci, Monsieur le Premier ministre. Merci, Monsieur Corriveau. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. Premier Higgs, I've spoken to many small business owners who have expressed some concern that potentially an Atlantic bubble could actually take business outside the province. Are there any interprovincial travel statistics from previous years that suggest Atlantic Canadians from outside New Brunswick visit our province as much as New Brunswickers visit other Atlantic provinces? And do you have an advertising strategy in place to promote it outside, to promote New Brunswick to the other Atlantic provinces?
We do, actually. Our advertising campaign is very focused now on what not only New Brunswickers traveling within New Brunswick, if the bubble didn't materialize, but more so now into the other Atlantic provinces. So certainly we will be focusing those and have the advertisements for P.E.I. in Nova Scotia and Newfoundland. So I think that, so now I guess you could say the Atlantic provinces, although working extremely closely together, are all in competition to attract tourists to their respective provinces.
Thank you, Premier. Ms. Hogarth, do you have a follow-up?
Yes, I do. It's also for the Premier. Premier Higgs, you mentioned today that each province will have its own rules for tracking and monitoring borders once the Atlantic bubble starts. How will New Brunswick be tracking interprovincial travelers?
So we are kind of on the front line in that sense by interfacing with particularly the other Canadian provinces, namely Quebec, and then of course with the U.S. But that becomes more of a federal issue as time goes on, working with the federal government. In the case of our side, we track people coming in, and they show us either if it's going to, let's say, onto Nova Scotia or the island or Newfoundland, but they'll show us that, okay, I'm going to this residence, I'm going to this destination, and then we allow them to go through our province so they can verify where they're actually going and why. In our case, that's someone who's going with an address into our province, we track them, we call them, and I think we do a kind of a random follow-up, but we check on their location and that they're isolating. So we'll continue to do that. Every border is going to continue to do that. So I know Nova Scotia, they meet residents too at their border, and then they understand where they're going and request that they isolate if they're coming from out of the province. The only change in our rules today will be that we would end up saying, okay, well, if you're coming from New Brunswick and you come to the Nova Scotia border or the P.E.I. border, they're going to say, great. They might ask for proof of residency in New Brunswick, and away you go.
Thank you.
Thank you, Premier. Thank you, Ms. Hogarth. Travis Fortnum, Global TV. Travis Fortnum, Global TV. Adil Ibrahim, CBC.
Thank you. This is a question for Premier Higgs. You mentioned that there will still be checks and screening at the border if there's a bubble. Can you describe what that will look like, how it's going to be different, and how will you make sure that there are enough people to screen people at provincial borders and at the airport?
Well, we have that system in place now, and the only enhancement we've had to make is with the increase in traffic. But we will see more routine traffic. And I guess people coming from out of the province and going to their summer place, that'll be routine coming week in, week out, so it becomes easy to identify or move through. And in the case of traveling through Atlantic Canada, there isn't a need. They may stop just to say, this is where we're going. We're coming from Nova Scotia, we're coming from P.E.I. And there's no real need to detain them in any way or get any further information. They need just a proof of address that where they live. So that'll be very easy in relation to our 4 provinces. But in the case of outside, like right now, from coming from Quebec into New Brunswick, or into Atlantic Canada from Quebec or Ontario, we are the first line defense. As I've said, we will be continuing our monitoring as we have done. And for now, the rules remain the same. This is an Atlantic bubble. You know, as I mentioned earlier, maybe it'll turn into more than that by mid to late July, but right now we're focused on opening up our Atlantic region.
Thank you. Ms. Ibrahim, do you have a follow-up today?
Yes, this could be for either the Premier or Dr. Russell. Just trying to understand how these rules are going to be implemented. So if someone from Nova Scotia begins their 14-day self-isolation period, let's say 5 days before July 3rd, will they have to continue self-isolating, or can they stop there?
Well, I guess if they're in a self-isolating mode because of their arrival, they certainly would need to continue that. And then once that isolation is complete, then they're part of the program where they can move around in the Atlantic region.
Thank you, Premier. Thank you, Ms. Ibrahim. Simon Delatte, l'Acadie Nouvelle.
Oui, bonjour. Une question pour M. Higgs, pour le Premier ministre Higgs. Donc, je me demande s'il y a eu des discussions avec le gouvernement du Québec pour ouvrir les frontières, donc peut-être une bulle régionale avec les régions voisines du nord de la province, notamment je pense à la Gaspésie, qui a été épargnée par les éclosions du virus. Et je me demandais s'il y avait un plan dans ce sens pour une bulle finalement régionale avec cette partie-là du Québec.
So at this point, I am not aware of any particular discussion for a regional bubble. We focused on the provincial issues. Dr. Russell may wish to comment. Public Health may have been talking about that with their colleagues. But for us, it's been only looking at the Atlantic region. And then if we move the next step later in July, we look at then Quebec, Ontario, and other parts of Canada. So at this stage, no, I haven't had any discussions that would isolate the Gaspé region with, let's say, Northern New Brunswick or New Brunswick.
Merci, M. le Premier ministre. M. Delatte, as-tu un suivi cet après-midi?
Non, la réponse est très claire.
Merci beaucoup.
Merci.
Elizabeth Fraser, CBC.
Hi, Premier. What rules will be put back in place if another outbreak happens in one of the other Atlantic provinces? And what actually constitutes an outbreak?
So those are details that we are working out right now in terms of the expectation, because we know that throughout the pandemic, each province is at risk of having more outbreaks. So it'll be kind of on a case-by-case basis at this time, because it'll depend where the outbreak is and how extensive it is. But those are parts of the discussions that we're having with the Chief Medical Officers of Health at the moment.
Thank you, Doctor. Ms. Fraser, do you have a follow-up today?
Yes, I have another question for the Premier. Earlier on, you said New Brunswickers would need to plan vacations within the province this summer, and we wouldn't be going anywhere else. Now you've been part of these Atlantic travel bubble discussions. Why the change now?
Well, you know what I've realized over the years that change is good, and as you learn more facts, you make decisions that are more related to the current level of facts available. And certainly, as we've worked together with other provinces, in coordination with the public health authorities in each province, we have seen that the control of the virus here within Atlantic Canada is well identified. Our experience in Campbellton, the contact tracing was excellent. The virus, any increased cases were related directly. So it was very, I think a position that public health could feel comfortable that this is known, this is defined, and this is under control. And it was the process that was identified quickly by public health that we want to be able to come into a region, understand it, contain it. And I think we learned some lessons through this, and I think part of it was, yes, we can manage a whole lot of tests. And yes, we maybe have some lessons to learn in terms of how we should protect ourselves in hospitals and how we learn to do that better. And those are things we experienced in Campbellton that could have been experienced anywhere in the province. So the lessons we learn from any experience allows us to make better decisions. So now we're in a similar situation across the Atlantic region, and we feel like this same situation can apply to any one of the provinces, and we can, each province is capable of containing, contact tracing, and managing life with COVID. And we know it's important to do just that because our economy needs to get moving, but people's social interaction need to be stabilized and get back into what they're used to in their everyday life.
Thank you, Premier. Thank you, Ms. Fraser. Andrew Watt, Telegraph Journal.
Hi, Premier. What kind of economic impact do you expect this regional bubble to have on New Brunswick?
Well, I would anticipate it'll be a positive impact. I'm looking for people to travel as much into New Brunswick, especially to experience our Fundy Trail that's just opening up early in July. So that's a new thing here for New Brunswick, a vista that is second to none anywhere, I would say, in Canada, and an opportunity for people to see New Brunswick in its entirety, but to come here and experience a new opening of a trail system that has just spectacular views. So I am looking forward to an increase in traffic, and not only our own people seeing our province, but obviously every premier is thinking the same thing. Every premier wants people to come to their place, and so I said, well, we're all getting along. We started up and to move into this bubble, but now, of course, we're all focused on trying to get people to come to our own province.
Thank you, Premier. Mr. Watt, do you have a follow-up today?
I do. Again, to the Premier, changing tax for a minute. The Wolastoqey Nation in New Brunswick put out a press release this morning saying that they're very disappointed that you have not already committed to calling an inquiry into systemic racism in New Brunswick, and that the task force you're suggesting is a half measure that will have no teeth and will not hold government accountable. How do you react to that? And, are you still considering calling an inquiry?
So my first reaction would be that over the past 24 years, we've had numerous inquiries that have resulted in just under 800 recommendations. So how much teeth did any of those have if the recommendations are less than 15% completed? I would suggest that what I'm proposing here is actually to put action beside recommendations, to actually see the conditions under which many people in the First Nations communities are living and working in change. I want to see real change. I don't just want to see another study, another committee, another task force. I want to see results. It's kind of been a thing I've grown up with over the years that I'd like to see the bar get better. I'd like to see the bar raised so everyone in our province is living in better conditions. And so I'm meeting with the chiefs again on April 8th. I'm looking forward to laying out a very clear path of how we can address real issues, like what's a top priority in the community. And right today, with certainly those tragic events that we incurred a few weeks ago, how do we address that head on to make changes? Because we value our law enforcement officers. We value the people that are protecting us, anytime, night or day, in all conditions. So we need to find a way to work through this. So everyone feels that security that we all value so much, and those that are putting themselves in positions we can't even imagine. How do we fix this situation so, yes, we do not have these situations happen again, and we have a system that constantly improves? We've been talking about this, and we've been talking about studies, and we've done studies. We just haven't accomplished anything in making real improvements.
Thank you, Premier. Thank you, Mr. Waugh. Laura Brown, CTV.
Hi, Premier. I'm wondering, Newfoundland and Labrador's Premier did commit to July 17th as a date to open up to the rest of Canada. I'm wondering if you have a date in mind, if it's the same day.
Well, we are talking about the same time frame in which we would open, but we haven't really landed on a date. So the 17th would be a day that's like 14 days out from the 3rd, which is, we've gone in sequence of 14 days in many ways to see what changes and are we seeing an outbreak. So I can see how that date gets thrown out there, but there hasn't been an agreement on any particular date. And that's why I used later in July, because we discussed it. We discussed the 14 days. We just didn't land on a specific date at this point.
Thank you, Premier. Ms. Brown, do you have a follow-up this afternoon?
Yes, just quickly, I'm wondering, once we now open the borders, how quickly or what is the threshold to close them again should we see a second wave? Will that, like, is another closure possible in the months ahead?
Hi, Laura. So again, we at the Chief Medical Officer of Health level with our public health teams will be constantly watching our epidemiology and the numbers in each province. And I answered a similar question on that around, it will depend on, we do expect there to be small outbreaks in each province moving forward. It's hard to predict when and how a second wave will occur, but we're actually doing some modeling right now in our department to look at what a second wave would look like, separate from the individual outbreaks that we expect to continue to see in each jurisdiction. So with respect to small outbreaks, we would take those on a case-by-case basis. Larger outbreaks, we would look at reimposing the limitations and restrictions that have been in place, but it'll depend on also what phase each province would consider themselves in, if it's localized or if it's at a provincial level. So these are all conversations we're having right now, and these are all the types of things that we will take into consideration as we move forward and as we look at what those, what the reimposition of restrictions would look like and what would trigger those.
Thank you, Doctor. Thank you, Ms. Brown. Tom Bateman, Times and Transcript.
Oh, good afternoon. I think this is best answered by Dr. Russell. It's a bit of a variation on the question asked previously. I just wonder what we as a province need to see by mid or late July to open the borders further. You know, for example, do we need to see a certain improvement in case count in Quebec, in Ontario, and elsewhere?
Hi, Tom. So at the national level, when we discussed this with Public Health Agency of Canada, as well as all the chief medical officers of health from the country, we had agreed a long time ago that if the R factor in terms of the rate of transmission was decreased low enough that we were comfortable having that kind of travel interprovincially happen, then we would do that. And so as of right now, if you look at the trends in each jurisdiction and collectively as a country, the trend is that the numbers are dropping, and so that's a good news story. And Ontario and Quebec obviously have been the hardest hit, and their numbers are dropping also. So as we continue to see those numbers dropping and them being able to control their outbreaks, that is very encouraging and very positive. So those are the types of pieces of information that we'll take into account moving forward. But again, the trends as they are right now are looking quite positive, so we will keep our eye on that.
Thank you, Doctor. Mr. Bateman, do you have a follow-up?
I do, thank you. Beyond the 14-day isolation rule that no longer applies between the provinces, why aren't we standardizing other protocol around, say, wearing masks, social distancing, even testing protocol, just to kind of remove some of the confusion that exists from one province to the next within the Atlantic region?
That's a good question, Tom. And again, we do discuss these at the national level with respect to having general guidance around our approaches, but that we as individual jurisdictions, provinces, and territories would be able to tailor that general guidance to our own data and to our own situations. So with respect to testing, the testing strategy at the national level has always been the same: test the right people at the right time for the right reason. And with respect to targeted groups and vulnerable groups, approaches that way. So we pretty much all embrace those principles in each jurisdiction. How that actually plays out across the country is slightly different, again, based on each individual jurisdiction situation and epidemiology. And sometimes there were things that were encouraged for different reasons, whether it was pressure or optics or questioning, you know, what would it look like if we did a different approach or did something different. So in Alberta, they did a large amount of asymptomatic testing for pre-op patients. After 8,000 tests, there was not one that came back positive. So we take those learnings and share them across the country if somebody is doing something different differently. So we use those as learning opportunities as to what we should do moving forward, either collectively or individually as jurisdictions. With respect to the testing strategy, again, with New Brunswick, we have been, adopting all of those principles. At this moment in time, we're comfortable with our testing numbers and our testing strategy. And as the Premier mentioned, up in Zone 5, we were very comfortable with how quickly we were able to mobilize testing units to be able to do. We tested 12% of the population up in Campbellton over the course of, my goodness, I think it was 4 days. So we've been able to sort of test some of these approaches and see what results we get as a result of putting those things into action. So again, learning opportunities there. With respect to masks, I have seen different approaches in different provinces. I think I just read recently that in Alberta they had handed out 14 million masks, community masks, the fabric ones, in drive-thrus at like Tim Hortons and McDonald's and I forget where else. So every province knows that when you're framing the risks around masks and the benefits around masks, it's important to put it in the context of this is one piece of protection in a list of many pieces of protection that are in place, whether it be border limitations, whether it be travel restrictions, whether it be physical distancing in large gatherings, or things like that. So they have to be taken into context that they're one of a multitude of things that protect people. And as long as people are aware of the limitations of some of those things, and that obviously the safest thing is to stay at home, and we can't have everybody stay at home or we won't have a functional society and we won't have a functional economy. So taking all of those things into account, the social determinants of health in terms of the collateral damage, unintended consequences, we have to take all of those things into account when we're approaching COVID-19 and the types of things that we want individuals to know and take away in terms of education and awareness to make good decisions.
Thank you, Doctor. Thank you, Mr. Bateman. Savannah Odd, Telegraph Journal.
Hi there. I believe my question is for the Premier. I've spoken with 2 Canadian citizens who are currently residing in the United States. They want to come into New Brunswick to support their daughter through a high-risk pregnancy and help her with childcare. They were told by the Canadian consulate in the U.S. that this is their right as Canadian citizens. They were told by CBSA in New Brunswick that they're okay to enter, but they've said that Service New Brunswick has told them that they don't qualify for compassionate travel entry because they aren't Canadian residents. Your policy around family visiting here, also you announced it with Canadian residents as the phrasing. Can you confirm for me if it's Canadian citizens with family, if Canadian citizens with family here can come visit, or if it's only Canadian residents? So if someone is coming from the U.S. and is a Canadian citizen, can they enter New Brunswick? Is that permitted at this time?
So I have to look into that particular case, even though you described it quite well. As I would understand, the federal government put a policy in about close family and friends being allowed to come into the country, but they wanted to have verification that they could come to a location and certainly self-isolate. And so I'd like to learn more about that case and the response that was received by the individuals. But it's I think there is a possibility there that might work.
Thank you, Premier. Ms. Odd, do you have a follow-up today?
Sorry, so I just want to be clear then. So does the compassionate travel exemption extend to Canadian citizens who are currently living abroad, and the new family visitation allowances at the border for people coming from other provinces, does that also extend, say, if I have family in
So I don't think that
Europe,
I
and they're Canadian citizens, can they come back and visit me now? So 2 pieces, I guess, the compassionate travel.
Yeah, so I don't think it's a broad-based policy as such, but I think there is room for compassionate, compassionate leave into the country, and I believe in the case of what Trudeau was proposing, it was for Canadian citizens, Canadian residents, but I would want to look into that a little deeper, because the federal policy did allow for some compassionate move across the border as long as there was a location, and I need to understand a little more about the federal rules in that case.
Oui, bonjour. Ma question est pour Dr. Russell. Alors, Dr. Russell, il y a 10 travailleurs de la santé à l'hôpital régional de Campbellton qui ont été infectés par la COVID-19. Est-ce que les mesures de protection pour les travailleurs de la santé sont suffisantes au Nouveau-Brunswick?
Oui, je crois que oui. C'est les protocoles qui ont été établis au niveau national de l'Agence de santé publique du Canada. Et cette information était transmise aux 2 réseaux et aussi les facilités de soins à long terme et aussi... alors, toute cette information était transmise et aussi, il y avait des processus dans chaque réseau pour assurer qu'ils ont eu l'entraînement, l'éducation et le propre équipement pour les différentes situations. Alors, est-ce que c'est toujours suivi? Je sais qu'on est tout humain, alors ça se peut que non, mais surtout, on a appris beaucoup de leçons avec la situation au Nord et on va continuer à collaborer avec les réseaux, avec la santé publique et nos partenaires pour faire certaine que toute l'éducation, l'information, les directives sont en place et aussi ils ont accès au propre équipement de protection. Au niveau de l'équipement de protection, on a des groupes de travail qui s'occupent les nombres de chaque différentes sortes d'équipements de protection. Ils savent combien qu'on a dans nos... ici maintenant. Au Nouveau-Brunswick, ils savent combien ont été commandés. Alors, toute cette information est disponible pour les réseaux pour savoir, oui, on est couvert, on est capable de fournir la protection que les gens ont besoin, comme les employés. Alors, ça, c'est des choses qu'on a l'information sur ça. Et à ce moment-ci, on sait que les staffs à l'hôpital, ils sont... en plus de l'équipement de protection, ils se font tester aussi au fur et à mesure que l'éclosion se déroule.
Merci, Dr. Russell. Madame Saint-Pierre, as-tu un suivi cet après-midi?
Oui, toujours pour Dr. Russell. Vous parlez des protocoles nationaux. Le Conseil canadien des syndicats des infirmières a dit que 20% de tous les cas de COVID au pays sont des travailleurs de la santé. Est-ce que vous pensez que justement, il faudrait réviser ces protocoles-là?
Alors, quand on dit qu'il y a quelqu'un qui est un travailleur de santé qui est infecté, je ne crois pas que ça veut dire qu'ils sont infectés à leur place de travail. On sait que les infections pour les travailleurs de santé peut être possible dans l'endroit où ils travaillent, mais on sait que ça arrive aussi en dehors de l'endroit où ils travaillent. Alors, il faut vraiment interpréter cette information correctement. Et ensuite, les infections avec les travailleurs de santé, on sait que c'est la possibilité est là. On essaie de communiquer le risque avec les employeurs pour faire sûr et aussi travailler avec WorkSafe Nouveau-Brunswick pour faire certain que les directives sont suivies et ils ont la protection qu'ils ont besoin, aussi l'éducation qu'ils ont besoin.
Merci, Dr. Russell. Merci, Madame Saint-Pierre.
Merci, Brooke.
Voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you very much.